After a decade without, a new federal chief nursing officer was introduced today. Federal Minister of Health Jean-Yves Duclos announced the appointment of Leigh Chapman to the position as hospitals across the country grapple with a shortage of nurses.
As Canada's chief nursing officer, Dr. Chapman will provide strategic advice from a nursing perspective to Health Canada, participate in the development of broad health policy, and represent the Government of Canada at public forums, both within Canada and internationally.
As the CBC's Megan Fitzpatrick reports, today's announcement is being welcomed by many groups who've been calling for the government to do more to address the healthcare staffing crisis.
The position of Chief Nursing Officer dates back to the 1960s, but in 2012 it was discontinued. The government at that time eliminated the position. Then in February of this year, this federal government said they would be bringing it back. They launched a search to fill the role, and today they announced it would be Leigh Chapman as Canada's new Chief Nursing Officer. Chapman has about 20 years experience in the field in different parts of the field. She's worked in clinical settings like intensive care units and emergency rooms, community settings like doing home care and working in harm reduction. She also has an extensive background in academics and research. She holds a master's degree and a PhD. She said in her remarks that she's humbled by her appointment. She looks forward to getting to work and being a strong voice for nurses in this country.
I recognize that there is significant work to do from a nursing perspective to ensure that we contribute to an accessible and safe healthcare system for all Canadians. I have a deep commitment to health equity and building a healthcare system reflective of all Canadians, especially marginalized and vulnerable populations.
And the federal health minister saying he's confident that Chapman will help increase the input and the influence that Canadian nurses have at the federal government level. Now, this announcement was welcomed by several healthcare groups who have been asking for the federal government to bring this role back. The Canadian Federation of Nurses Union said that they look forward to working with Chapman.
She won't have a long onboarding into a new job. This is a crisis. We have a health human resource crisis, and that's why ERs and departments are closing across Canada. So she needs to get and meet with real union activists and employers to see what can be done to retain nurses.
And other groups too saying this announcement couldn't come at a better time given what's going on with nurses right now, the burnout that many of them are feeling. Some are leaving the field. They are exhausted after working on the front lines of the pandemic, and they are hoping that this appointment of Chapman today will help make a difference and improve conditions for nurses in this country. Megan Fitzpatrick, CBC News, Toronto.
For more on how this announcement will impact Canada's nurses, I'd like to bring in Tim Guest in Halifax. He's the CEO of the Canadian Nurses Association. Tim, appreciate you taking the time.
Thank you.
So what do you make of today's much anticipated announcement that coming back after 10 years is a chief nursing officer?
We're really pleased that the federal government made this announcement. As has been reported, we've been advocating with the federal government for a period of time to have this position reinstated. Nursing is the largest component of the health workforce. And we believe that nurses have a lot of expertise to contribute to both strategic planning, health system policy, decision making, and we believed that there needed to be a nursing voice right to this level, and it was a gap. And so we're really pleased to see that in place. And now there is a need for us to get to work and work through some of the significant issues that are impacting the nursing profession and the health system.
Mm-hmm. I mean, retaining nurses, exhaustion, not having enough, closing ERs. I mean, the long list of challenges that Leigh Chapman faces is just daunting. So what would you like her to really tackle first?
I think for us, it's a matter of listening to what nurses believe is the way out of this. I believe that we have ideas and potential solutions. I believe it's about creating an opportunity to have dialogue with the provinces and territories. The only way out of this crisis is for the federal government and the provinces and territories to work collectively together. And as nurses, we want to participate and we want to contribute.
So what is the way out? I hear you on that the federal government and the provincial governments have to sort of collaborate and be collaborative more. But what is the way out of this staffing crisis?
The biggest one is that we need to retain what we have, and that needs to be our highest priority.
How do you do that?
Well, really, I think it's about listening to nurses and understanding what the reasons are that they're talking about leaving. And it's largely their work environments. They are working short. They have excessive workloads. They are working exceedingly larger amounts of overtime, more overtime in this year than what has been seen in the past. We're staffing the health system on extra work of people, and the capacity of the health system in Canada does not match the capacity of the workforce that it has. And there is a need to look at anything that we can do to improve the work environment that nurses are facing. I hear from nurses all the time that they are no longer happy going into work. That's part of the burnout issue, is that nurses have been plagued for over 2 years with extreme pressure. They've had no ability to regroup. Nurses have dealt with crises over the last 100 years in our profession, but never with something that's been this prolonged with this level of pressure.
How do you make a nurse happy to go to work as the pandemic continues and fall and winter is coming?
I think it's about knowing that they're going to get to go home when the end of their shift is planned. It is knowing that they're coming to work and that they have a patient assignment that is typical, that's not 2 and 3 times what it should be. It is knowing that there is adequate additional supports that are there so that nurses aren't cleaning, they're not answering telephones and doing some of these other things, that there are other individuals in the workforce that can help with that. And it's being able to have a voice and contribute to the solutions and actually see their contribution heard and implemented.
Tim, appreciate you contributing to this conversation. Thank you very much.
My pleasure. Thanks for the opportunity.
Tim Guest is the CEO of the Canadian Nurses Association. He joined us live from Halifax.